Hi, my name is Dr. Miriam Salt. I'm an associate veterinarian at Seattle Veterinary Associates, and my colleagues asked me to do a short presentation on my experience working with anesthesia-free dental group, which we prefer to call non-professional dental scaling. I thought it was important to share my experience and help educate the public about what actually goes on behind the closed doors during these dental scaling procedures. So one of my major concerns with this procedure is the restraint that's involved. Most of the small dogs, or medium-sized dogs, so large dogs, were placed on the floor like this with a fairly strong head hold. A mouth gag, which I'll show you in a minute, was used to keep the mouth open. And then the larger dogs were used in a leg hold as well while the dental scaling was being performed. The tiny dogs were wrapped up into a burrito, kind of like this, with a towel and held very tightly, such as this. Obviously, some of the animals became extremely stressed with this kind of restraint, particularly because their mouth was being performed on. Some of the animals did urinate, defecate, express their anal glands, and I was concerned about some of them being able to breathe appropriately while the procedure was being performed. So I'm using this just to demonstrate the mouth gag that was used in the animal's mouth. So what goes on in these dental scaling operations? Basically, the person doesn't have any formal training in either veterinary medicine or dentistry, and they take a hand scaler and scrape off the tartar that's visible, tartar and plaque that's visible on the outside surfaces of the teeth. Obviously, in an awake animal, it's very limited on how far they can go. Can they get the inside surfaces? Maybe a little bit. There's major concerns that this isn't really doing anything for the health of the teeth, and it's purely cosmetic. It looks nice to the owner. They have some cleaner teeth when they come out of the room. But as far as dental disease, it's really not doing a whole lot. Dental disease in animals where we get really concerned about is above and below the gum line, the subgingival pocket where the periodontal disease actually exists. Obviously, we can't access these areas in an awake animal, and in order to perform a proper professional dentistry, including polishing and x-rays, probing for pockets, and extracting teeth that are diseased, anesthesia just really needs to be used in our patients.